Jai. I'm the head of inclusive growth with UNDP. And it is really my pleasure to deliver these opening remarks at this webinar organized jointly with the IPC-IG, International Policy Center for Inclusive Growth, on the key findings of our newly released publication titled Next Practices, Innovations in the COVID-19, Social Protection Responses and Beyond. Colleagues, you would agree with me that this is a time of unprecedented challenges. The COVID-19 pandemic has necessitated large-scale and rapid responses from governments to ensure that the negative effects of the crisis on people's livelihoods are mitigated. And we all agree that only a big push can get us back on track to deliver on the SDGs. Working with countries over the next 4 years, what UNDP strategic plans tries to do is to expand. One of the key ambitions is to expand human capabilities through which 100 million people could escape multidimensional poverty, also as a way to reinforce pathways for greater prosperity for all. To support the implementation of the strategic plan, UNDP's social protection offer that has been released in this year builds on the social protection component of our COVID-19 offer 2.0, which, as you know, aims to provide not only immediate relief, but also look beyond recovery toward 2030. So our approach to social protection is an integrated one that aims at supporting those that have been disproportionately affected by the pandemic. And the offer is articulated around 12 social protection solutions that cut across 3 thematic components. First, governance, second, resilience, and third, environmental sustainability, with the aim of supporting 120 countries by 2024. Just to give an example of what we've been able to do throughout 2020, we have supported over 80 countries with different focuses to protect jobs and informal workers, support the vulnerable, help us access to financing resources, going beyond income to understand who to target, but also leveraging the results of the socio-economic impact assessment to elevate our advisory services, but also making digital the default, building upon an expanding partnership, and ultimately harnessing innovation, which is kind of the key thematic of our meeting today. What this report, which is, like I said, a joint one with the IPC, aims to do is really to curate social protection innovations that have been implemented as part of the response to the COVID-19 crisis, and innovations that can be leveraged to build more inclusive and sustainable social protection systems, both in the medium and the longer term. And it's meant to support country offices and member states harness those lessons learned so that they do not need to reinvent the wheel, but really use them as guidance that can enhance not only their policy, but also their programmatic practices, AI, what we call the next practices. And to support this overall social protection plan that we have within UNDP, we also have designed an implementation plan, which really aims to support country offices that needs the support of BPS and associated partners, namely the IPC-IG, but also the UK Institute of Development Studies, where we work closely with Professor Stephen Devereux to implement social protection projects and programs. So, colleagues, this is what I wanted to share as a way of introduction, and would like also to remind you that you can feel free to share questions throughout this session. And I'm happy now to hand the floor back to Fabio, I believe, for his presentation. Fabio, thanks, and over to you.
Thank you, Mansour. Good morning, everybody. So this presentation will be shared with me and Maya Hamad, who is going to be speaking from Jordan, and who is actually the first and the leading author of this joint paper between the IPC-IG and UNDP. I would like also to take the opportunity to thank all colleagues from UNDP, especially from the Inclusive Growth team and the different regional hubs who have commented extensively, and I'm sure they have improved a lot this paper, even though any faults or mistakes, of course, from the authors. Just to quickly go through what we're going to cover here, I'm going to speak about the definition of innovative practice that we have used, and I'm going to give you an overview of the social protection response in the Global South. After that, Maya will take over and she will navigate us through the fiscal, space, and sustainability response, the enabling factors for these responses, and also which were the innovative practice in social protection design and implementation that we have identified in this research. And we'll finalize with the lessons learned. Next slide, please. So the objective of the next practice paper is to systematize the social protection innovations implemented in response to the COVID-19, to showcase the factors that enable this quick response, as Mansour mentioned, and also to provide lessons and guidance on how to include the leave no one behind groups, and also how to support countries in going back into the track in order to achieve the SDG target 1.3. That's basically to expand social protection coverage. The methodology that we adopted, it's based on a literature review of papers and documents that have been produced in relation to the social protection response to COVID-19, and also the IPC-IG dashboard and database on social protection response to COVID-19, complemented by information from other databases such as the World Bank, ILO, and the UN Women UNDP gender tracking. Next slide. So how we defined innovation? That's an issue that we discussed a lot with Mansour and the colleagues for UNDP. So when we talk about innovation, innovative practice, we're not necessarily talking about something new. It can be actually a new, an existing or pre-existing tool or instrument that have been adopted and implemented in a different context. And that's what actually we saw a lot in the social protection response. So as we took a shock responsive social protection lens in the IPC-IG dashboard, we defined this innovative practice for the sake of the paper as the changes and practice that have enabled the rapidly and effectively enhance the coverage, adequacy, and resilience of the social protection system. And here we can see that one of the challenges that we have when we talk about the coverage is that we may be missing other dimensions of social protection, such as the adequacy and also the resilience, especially when you have a shock. So when you have a shock, we need to also see if those that are receiving adequate social protection. And also to see if the social protection system is capable to resist the shock and implement programs and services as they used to do, but of course, adopting instruments that will allow to cover everybody. In that sense, it's also important to highlight that when we talk about innovation, we're not necessarily talking about digital technologies. It can be also other types of changes and adaptations, such as governance and process. And that's what we're going to see during Maya's presentations. Next slide, Maya. So just to give an overview of what countries have done, here we have a summary of key factors. And one of the most impressive things, as Mansour had mentioned in his opening remarks, was the rapid response and also the coverage of this response. So many countries have utilized social protection instruments to respond to the crisis. And that, of course, has implied a fiscal cost. So the fiscal cost has been estimated by the IMF in the first 12 months of the response in $16 trillion, out of which almost 18% was actually related to social protection measures. So it was quite sizable, especially if we compare to previous crises such as the global financial crisis of the late 2000s. But it's also important to keep in mind that the per capita social protection expenditure differed by countries. So low-income countries and high-income countries or upper middle-income countries replied very differently and used different instruments to reply to the crisis. And that's what I'm gonna see now using the IPC-IG dashboard. So the first thing that I would like to highlight to you is that actually low-income countries were responsible for 11% of the COVID-related social protection measures that we have mapped, although they were 18% of the country. So it suggests that they have a much less varied response, especially if we compare with the upper middle income countries, that even though they were responsible just for 30% of the sample, they were actually responsible for 40% of the social protection measures. Next slide, Maya. So here we see which type of instruments were used by country. So we can see that cash benefits were like by far the most utilized instrument, and combined with liquidity alleviation, it corresponds to 77% of the social protection measures, followed by in-kind transfer, that's basically 13%. So overall, 90% of the measures were either cash benefits, liquidity alleviation, or in-kind transfers. So what's liquidity alleviation and why we're talking about liquidity alleviation here? So the objective of liquidity alleviation is actually to increase the disposable income of a family's household and a small business. So it's not that we're getting the transfer, we are getting actually an indirect subsidy that would increase your disposable income. And for example, there was flexibility in the payments for Social Security for employees and also for self-employed, subsidized credit, and of course, the food subsidies and public utility subsidies. Cash benefits were more common in Latin America and the Caribbean, and also in East Asia and Pacific, and much less common in South Asia and Sub-Saharan Africa, where in-kind transfers and liquidity alleviation measures were more prevalent. But it's also important to see that subsidies played a major role, especially in low-income countries where they have represented 31% of the measures. For example, in upper middle-income countries, there were only 10% of the overall social protection measures that were undertaken. And finally, it's important to highlight that wage subsidies played a very important role. It was not only emergency cash transfers, but they were more important actually in high-income countries. They were responsible for 20% of the measures compared to low-income countries where they were responsible just for 3% of the measures. Next slide, Maya. So if you look now at subsidies, and that's one of the differences of our mapping, we really tried to look at how countries were using different social protection instruments. We can see that public utilities were quite common, but they were much more utilized in high-income countries. And here we can see a first glimpse of the innovation that countries have taken, because we see that subsidies, fee waivers on mobile money or internet subsidies were quite prevalent in low-income countries and low-middle-income countries, with 35% and 29% respectively. That has to do with one of the major innovations, especially in Sub-Saharan Africa, in utilizing mobile money for the payment of social protection benefits. Next slide. So the majority of the measures, and that's probably you know already because most of the papers have commented on it, have used social assistance programs or social assistance measures, followed by labor market measures, and to a lesser extent to social insurance measures. Across country income groups, while social assistance measures represented the largest proportion in response to all groups, it was actually the low-income countries that have used it more, 89%. And there we are going to see that subsidies played a quite important role, not only the cash benefits. In contrast, as I mentioned before, social insurance interventions represented a smallest proportion on the total, being more relevant, of course, in high-income countries and upper middle-income countries where you have more formalization of the labor force. Next slide, Maya. If we look at a breakdown of social assistance, we are going to see the different types of cash transfers, like emergency cash transfers and conditional cash transfers, but also subsidies that have played a very important role. But I would like to draw your attention to school feeding programs that were quite important in Latin America and the Caribbean as a social protection response, the adaptation of school feeding programs. But most social assistance measures were actually expanded horizontally, which means that they have increased the number of beneficiaries to those that were not previously covered. And this coverage expansion was mostly through the introduction of new measures, so new emergency cash transfer programs. And vertical expansion occurred through the increase of the amount of the benefits. And here we related to the issue of adequacy. So it's not only the issue of coverage, but also the issue of adequacy. And the measures that expanded their coverage targeted mostly poor and vulnerable households or poor or vulnerable individuals. So there was this difference in targeting whether individuals or whether households were being targeted. And also in third place, informal workers. And we know a lot that the informal workers were major targets of most of these measures, even when they were trying to target mostly the poor and the vulnerable. Next slide, please. In terms of the breakdown of the labor market measures, we can see here in blue, in light blue, the importance of wage subsidies, with the exception of South Asia. It was important in several countries, but South Asia, it was a much smaller proportion. And in most cases, wage subsidies, they have expanded the coverage of social protection. So it was a horizontal expansion. And this expansion, similar to social assistance, occurred through the introduction of new measures. And the vertical expenditure, and something interesting, occurred through the introduction of new program components for existing beneficiaries of other social protection components. And here, of course, it's labor market. So most of the target group was formal workers, but we did see an increase on informal workers having access to labor market measures. You can see that 35% of the labor market measures also targets informal workers. We can see, for example, that while in Latin America and the Caribbean, we see the largest proportion of programs that were specific to informal workers, 15% of the labor market measures. In Sub-Saharan Africa, it was the largest proportion of programs that allowed formal and informal workers to benefit from the measures, reaching 38% of the labor market measures, encompassing both groups. The next slide. And finally, we go to social insurance, and it was mostly contributory pension. You can see in dark gray that was observed in most regions. But here, one thing that was quite different was that what we really saw in terms of social insurance was implementation changes rather than expansion horizontally, where the implementation change was quite important. And here, in terms of the contributory pension, since the elderly were like the first group to be highlighted as one of the most affected by the pandemic, there was lots of intervention that had anticipated payments for the elderly, in payments that they would receive anyway. So it was not actually in a horizontal or vertical expansion, but there was an implementation change in the sense that these benefits were anticipated. And finally, of course, social insurance target mostly formal workers. So just to give an idea, informal workers was targeted only by 20% of the programs. In that case, shared 15% sharing with formal workers and 5% exclusive for informal workers. So over to Maya for the remaining of the presentation.
Thank you a lot, Fabio. So in the report, we discussed two requirements for successful implementation. These are financing and coordination mechanisms. And in terms of the fiscal space, the IPC dashboard had looked at the sources of financing of the response, categorized into public, private, and international sources, as well as social security. Here in this slide, we give a brief overview of the utilization of these sources, but first, it's really important to note that financing information was only available for 64% of measures in the dashboard. So public sources of financing include things like the state budget, budget reallocation, extra budgetary funds, among others. Private sources of financing include zakat funds, individual and NGO donations, private sector donations, as well as other types. International sources of financing include international organizations, donor countries, regional development banks, and international financial institutions. So we see here that 69% of the measures across the Global South were financed through public sources, followed by international sources as shown in figure 3.1 at the top left side. We can notice here a larger role of international financing in sub-Saharan Africa and a small role of social security financing. In the Arab states, we also see 17% of measures financed by the private sources of financing, and this is due to the prevalence of zakat financing and NGO donations that we saw in the region. And in terms of the division of income group, we see international financing playing a larger role in low middle income countries and low income countries. and absolutely no cases of the use of social security were mapped as a source of funding in low-income countries, as social assistance, as Fabio had discussed earlier, was the prioritized mode of the response. So within public sources of financing, the majority of measures at 80% were financed by state budgets. 7% of measures were financed by newly established extra budgetary funds across all regions. Other public financing instruments utilized, which we won't get into today, but are discussed in the report extensively, are budget reallocation from non-essential expenditure and the utilization of existing contingency funds. As we can see from the figure, extra budgetary funds were utilized across all regions. They're shown in black. These are defined as a set of accounts or a government entity engaged in financial transactions, often with a separate banking and institutional arrangements that are not part of the annual state budget law. The most prominent advantages of extra budgetary funds for financing short-term responses are that they permit the pooling of public and private financing, and also allow some stages of the formal budgeting processes required in normal times to be bypassed. In the IPC dashboard, we saw these funds being utilized by 18 countries in the Global South to finance 36 social protection measures, either fully or partially. These funds can differ in their level of integration into the public financial management system and the funding source that they have. So some of the examples which we found to be very successful and discussed extensively in the report are Colombia, Jordan, and Mauritania. Within public financing, we also saw the introduction of new taxes to finance social protection responses. Mongolia and Zambia used mining and gas taxes to finance social assistance schemes. Countries such as Mauritius and Panama have used sin taxes or excise taxes on tobacco to support social security interventions. Excise taxes are regarded as innovative financing instruments which can simultaneously expand the fiscal space and promote better health practices in the long run. And research has indicated that there is scope for a better utilization of excise taxes across different regions in the Global South. Research has also by the ILO has also shown that internet tax or taxes on big tech companies are the most innovative, sustainable, and progressive financial instruments. However, some of the challenges here are related to political willingness and also the difficulty of implementation. Nevertheless, in May 2020, we saw Indonesia introduce a 10% value-added tax on digital products sold by foreign internet platforms with a significant economic presence in the country, such as Netflix, Google Play, and Amazon. The country had also set an income tax obligation for such entities, which could reach almost 37.6% if the platforms are deemed to have a permanent establishment. The law was originally meant to enter into force on January 1st, 2021, but it was brought forward in order to, one, capture the shift in people's consumption patterns as a result of lockdown and the pandemic, two, offset the drop in tax revenue caused by COVID, and most importantly, promote fiscal stability during the pandemic. Since Indonesia has one of the world's highest number of internet users, approximately 171 million, the tax measure has a high scope for generating a lot of funds for the government, but with the consumer inevitably bearing the brunt of it. Another country that has introduced something similar is Malaysia, which introduced a 6% digital services tax in January 2020 on digital service providers. And this has managed to raise 253 million in 2020. However, it's really important to highlight here that at the time of writing the report, there was no evidence on whether Indonesia or Malaysia had utilized the additional liquidity generated for financing SP measures particularly. However, their implementation showcases that it could be a potential source in the future. So in terms of private sources of financing and international sources, this slide is an attempt to give a quick recap on both. In private sources of financing, we saw a role for community-based financing, for example, used to expand national social protection measures or to establish new ones. In Egypt, we saw a coordination between the Ministry of Social Development, Social Solidarity, and NGOs to finance the second round of horizontal expansion for the country's flagship conditional and unconditional cash transfer program. We also saw NGOs finance Guatemala's food support program during the pandemic. Community-based financing was also used to fund measures targeting previously uncovered groups. And for example, in Kuwait, we saw the Zakat Fund, the Ministry of Social Affairs, and NGOs collaborate to finance a response targeting migrants and stateless persons in the country. As for international sources of financing, we see that the majority of measures, at 42%, were financed through international financial institutions. We noticed also that regional banks contributed at varying degrees across regions. They financed, for example, a larger share of the measures in East Asia and Pacific, as well as Latin America, than they did in other regions. So in terms of the best practices for financing, it's really important to note that no single innovative practice can succeed in financing shock responsive social protection, but rather countries should combine multiple financial instruments that correspond to the severity of the shock and, of course, the frequency of its occurrence. It's also worth mentioning that the positive aspects of a practice are entirely dependent on the way it is designed and implemented. So here we have collated a list of these practices without going into detail. These are establishment of extra budgetary funds for short-term response, implementation of budget reallocation from non-essential expenditure, unlocking contingency funds, utilizing unconventional taxes, and leveraging donations and coordinating them from different sources. For further details on the country examples that were very successful in these areas, and most importantly, the lessons learned for a future shock responsive or financing shock responsive social protection, these are discussed in detail in the report, but for time reasons, we won't get into them today. So before getting into the innovative practices when it comes to the design and implementation of social protection measures, it's important to highlight some enabling factors which we have discussed in the report. To start with, it's important to have strong coordination mechanisms through establishing social protection emergency response committees, including a variety of actors, governmental, non-governmental, people from the social protection sector, people from disaster risk management. And within such committees, it's really important to have a clear mandate and clear hierarchical relationships between the different actors. It's also really important within coordination mechanisms to engage private actors, NGOs, and workers' unions, not only in policy implementation, but also in the design process. And here, the inclusion of both formal and informal workers' organizations, and in cases where migrants are excluded, it's very important that special measures are taken to ensure their inclusion, either through direct consultations with migrants or actually engagement with international organizations that have already been doing this work. And finally, within coordination mechanisms, it's really important to mobilize local government officers, district and divisional secretaries in the implementation. Another enabling factor is definitely the wide coverage and currency of data in governmental databases. And this includes having widespread national ID coverage, existence of digitized ID systems, having accurate and updated waiting lists for speedy identification, and definitely interoperability between governmental databases. Finally, another enabling factor that we've seen in experience with digital financial infrastructure, and important elements here are the existence of favorable regulatory frameworks or the capacity to issue and develop ones that are, and also high rates of mobile ownership and internet connectivity. So in terms of identification and registration, here we have two figures that show us the most utilized methods across the Global South. Figure 4.1 showcases beneficiary identifications. Most measures at 35% relied on open registration through web portals, followed by 27% of measures utilizing social security and tax databases for identification. We can also notice that the utilization of social registries was more prevalent in Latin America and the Caribbean and East Asia and Pacific. As for registration, we see that the most utilized method across the Global South was web portals at 38%. And an important added benefit of web portals and online platforms throughout the pandemic is that they allowed for the registration of groups that are traditionally excluded, such as informal workers. And they were used exactly for this purpose in the response of countries like Brazil, Iran, Morocco, Kuwait, Jordan, Egypt, among others. So in the report, now moving on to identification and registration and the innovative practices and related to them. Here, we have discussed 8 best or innovative practices and their corresponding lessons learned. But for now, we'll be focusing on 4 particular ones. The first one, which has enabled a rapid response, is the use of social registries to identify beneficiaries. And really great examples here are Pakistan and Brazil. In Pakistan, we see that the Ihsas emergency cash transfer program consisted of the inclusion of households that were already in the National Socio-Economic Registry, and the program resulted in a coverage of more than 50% of the population. The second practice to highlight is the ease of or eligibility criteria, and very importantly, the documentation required for benefiting and using waiting lists for existing programs. So we saw that waiting lists were used for rapid identification in Iraq, expanding coverage to 60,000 new additional households. And in terms of the inclusion of migrants, we saw Colombia as a great example here because local authorities had shown a lot of flexibility in terms of recognizing expired or alternative documents from Venezuelan refugees to enable them to benefit from social protection programs. And then, of course, some of the lessons learned here are having the effective use depends on the coverage, accuracy, and currency of the social registry information, considering most inclusion versus what is possible, setting disability inclusive eligibility criteria, considering the duration of eased eligibility criteria, and informing beneficiaries of it, and also taking into account the type of alternative identification requirements necessary for migrants and refugees. For example, in the Colombian example, which we talked about, the identification document which they relied on was the refugee's work permit, but nonetheless, this would still exclude refugees which do not have a work permit. So this is something really important to consider in the future response. Lastly, it's really important to rely on local actors for beneficiary identification. We saw in Sri Lanka that the identification of self-employed workers happened through local authorities. And in Kenya, we saw that local actors played a very important role in identifying youth from informal settlements to benefit from the country's public works program. Important lessons learned here is, of course, considering who to involve, what type of local actor, as this may have social exclusion implications depending on the socio-economic and political and social context. Also covering the costs incurred by local actors, contributing to strengthening their capacity, especially if the program in question is about identifying persons with disability. And finally, as was mentioned before, including them in policy design as well as implementation from the outset. Other best practices related to identification and registration is the setting up of open registration mechanisms and online portals and SMS services, which we mentioned before. Two very notable examples here are Morocco, which utilized firstly the database of existing beneficiaries to identify potential beneficiaries for the government's emergency cash transfer. And then in the second stage, they created this SMS service so that informal worker households can apply and benefit from the program. And these two identification mechanisms combined had allowed the government to reach 71% coverage for its emergency cash transfer program. Another example is Togo, which depended on a USSD platform developed in less than 10 days, which was marvelous. And given Togo's lack of a strong national ID system, the eligibility verification process relied on cross-referencing applicants' data with the recently collated voters' ID database. However, a very important lesson learned about utilizing digital or open registration through web portals is the importance of setting up helplines and complementing digital registration to ensure that people without access to digital mechanisms can still benefit. And another important lesson is to ensure that the process is entirely disability inclusive, for example, by creating systems that could be screen reader compatible, or allow for sign language options as well. And finally, we see that countries such as Namibia had relied on the civil registry to verify data. And here the ID numbers of applicants to the emergency income grant were used to cross-check eligibility from a number of governmental resources, such as the National Population Registration System, the Taxpayer Database, the Student Financial Assistance Fund database. And at the time of writing, this interoperability between the governmental systems had allowed the saving of almost 6.6 million in disregarding applicants that were not eligible to the program. So moving on to the payment mechanisms, we see that the most commonly used mechanism here is bank transfers at 52%, followed by mobile money at 18%. Bank transfers were utilized less in the Arab states and sub-Saharan Africa, where manual cash payments and mobile money were more prominent respectively. In terms of the best practices that we've identified for payment mechanisms, it's definitely the facilitating remote opening of bank accounts or mobile money through IDs, or definitely other identification mechanisms. A great example here is Brazil, which allowed the remote onboarding through national IDs for a new bank account. And this resulted in the financial inclusion of 14 million new individuals within a week. And noting the lack of IDs, some countries have utilized alternative methods to verify individual data for the purpose of opening accounts. Two notable examples here are Bangladesh, which had relied on employment records to facilitate the opening, and Philippines, which had actually waived the ID requirement entirely for customer onboarding and transactions to enable assistance. Of course, some of the lessons learned here is the importance of establishing tiered bank accounts with tier-based customer due diligence mechanisms to allow more inclusion, and also accept alternative forms of IDs, accepting expired ones, waiving the requirement entirely, but also making the process for ID renewal or ID obtaining easier. Another best practice that we've seen, which allowed for a very rapid delivery of assistance, is the adoption of mobile money and facilitating the opening of mobile wallets. A great example here, which is discussed in the report, is Jordan, which had simplified Know Your Customer requirements and allowed for remote account opening for mobile wallets for the Daily Wage Worker Emergency Cash Assistance Program. Some of the lessons learned from the country examples mentioned are the importance of collaboration between mobile payment service providers and telecom companies to reduce the number of inaccessible wallets, implementing non-ID based registration through, for example, reusing SIM registration data. And another best practice is, of course, the combination of digital, partially digital, and non-digital payment modalities. And great examples here are Peru in its Bona Familiar Universal Emergency Cash Assistance Program, where they utilized 4 delivery modalities. And to quickly wrap up on this section, in regards to women's access to payments particularly, it is noted that given their lower rates of having IDs, owning mobile phones, or being connected to the internet, or due to the fact that some countries require the male head of the family to issue sufficient documentation allowing for women to open bank accounts, women might be excluded from digital payment modalities, and as such, some best practices here could be the implementation of multiple payment modalities, which has been done in Peru, the prioritization of prepaid cards over mobile money to provide more access to women, as prepaid cards do not need mobile phones or IDs or internet access. And if mobile money is the chosen delivery method, then countries consider providing mobile phones alongside SIM cards and connectivity, which has been done previously in Zambia. Replacing ID verification requirements and reusing information provided in the past for SIM registration. And just to quickly go over some of the best practices identified in communication, case management, and grievance redress mechanism, definitely it's the dissemination of information through multiple platforms and in different languages, and the involvement of local actors in the dissemination of information and also in the content preparation, including grievance redress mechanisms in program design from the outset and offering several ways to file a complaint. We've seen the utilization of mobile grievance agents in many countries, which was great to ensure access to grievance redress mechanisms for people in rural communities, in very inaccessible mountainous areas. And also the importance of adapting case management based on the risk assessment of the severity of COVID in the family or the neighboring area. And here, just to quickly recap, what the pandemic has shown us is that redundancies or a multiplicity of registration or payment or communication mechanisms are really necessary to make sure that no one is left behind. And since they guarantee that programs are accessible and coverage is widespread, and also to account for unforeseen delays, challenges, or flaws in implementation mechanisms. To recap some of the lessons learned in the different sections of the report, for example, in financing, again, it's really important to combine multiple financial instruments corresponding to the severity of the shock, and this be based on a risk assessment and financial planning. In terms of coordination, it's really important that the work of newly established social protection response committees is streamlined with existing disaster risk management units. It's really important to have participatory policy design, as we mentioned earlier, and it's definitely very important to build on the partnerships that were created during the pandemic and to develop standard operating procedures for future shock responsive social protection efforts. In terms of the identification and registration, definitely social registries, online portals, and mobile platforms were essential in ensuring the rapid response, and thus the coverage and relevant and currency of the data is really important for countries to invest in and work on. But what we've also seen is that implementing complementary non-digital mechanisms and the involvement of local actors is really key to ensure that those hardest to reach are actually identified and registered in emergency programs. And it's really important for countries that have low ID coverage to think through the best way to implement an alternative to ID-based registration. In payment mechanisms, again, here the utilization of digital modalities was really great for rapid assistance delivery in Togo, Jordan, and Namibia, are some of the examples we mentioned in the report. But here, the implementation of complementary non-digital mechanisms, considering the inclusion of women, the inclusion of elderly is really important. But it's also shown that the formalization and regulation of tiered accounts is really important, not only for shock responsive social protection, but for wider financial inclusion in the future. And finally, in terms of communication, case management, and grievance redress mechanisms, similar to the things mentioned prior, here we see that there is really important to have a variety of channels for communication. And it's really important for shock responsive social protection mechanisms in the future to consider the design of grievance redress mechanisms, referral methods, and case management processes in the future. And with that, we thank you so much for giving us the time to present the report, and we're looking forward to all of your questions in the Q&A session. Thank you.
Thank you, Maya and Fabio. That was a really great presentation, covered a lot of ground. My name is Shirani Nayyar. I'm the Policy Specialist, Social Protection. Welcome, and please feel free to type your question in the chat, or maybe if you can stop sharing, or feel free to raise your hand if you would like to ask your question. For now, to set the ball rolling, maybe I can pose my question, exploiting my position as moderator. So Fabio and Maya, you spoke about the use of social registries for beneficiary identification, and they were one of the first best practices that were listed. How about single registries? This is a term that has been used. What is the difference between social registry, single registry, and is this associated in some way with targeting or universal approach? And just wanted to hear your views on that. I would like to give the floor to Carmen, and maybe we can collect a few questions and then cycle back to the presenters. So Carmen, please go ahead and unmute yourself if that, yeah, go ahead.
Hi everyone. First of all, thank you so much for the presentation. This has been really interesting, especially since I'm also trying to analyze some of the UNDP data that is shown in, I don't know if you have heard about it, there's a global gender response tracker. And I think some of the information is quite similar and it's definitely very interesting. And one of my key questions for you guys would be, how many of the measures you have analyzed do you see that could continue being implemented in a middle or more long term, since it's supposed to be more COVID oriented, but definitely there must have been some measures that could continue behind this pandemic. So how do you see these measures working out? And if in the moment they were presented, did they have in mind that this could continue being something more than just a very temporary measure? Thank you.
Thank you, Carmen. And we also have a question in the chat from Natalie, and she is asking if there are any specific insights for fragile and conflict-affected countries. So maybe we can take that first set of questions. Over to you, Fabio and Maya.
Okay, thank you, Shivani, and thank you everybody for the questions. On the social registries and single registries, actually we tried in our mapping to distinguish those who have used what we call beneficiaries database from social registries. I think that single registry is actually a modality of social registries in which we have large sections of the population, not necessarily only those who benefit from a specific program. That would be more related to a list of beneficiaries. So if you have a larger social registry from different programs and not only those that are really like extreme poverty targeting oriented, you can immediately implement a reply, not only in terms of the vertical expansion, you can add a new program to the existing one, or you can increase the value of the benefit, but you also can increase immediately the number of beneficiaries. But most of the innovations that we saw, actually, they have enabled alternative modes or modalities to register for the program and use their other administrative database to check the accuracy and the eligibility for the new emergency cash transfer. So that would be a little bit the innovation that we saw. Just to jump into the question that Christian posted here, we saw that the average duration of the interventions, or especially of the emergency cash transfers, was around 4 months. So there was this first idea that the pandemic would last for 3 months. Many cases we saw durations of emergency programs of 3 months. Of course, we have just one-off payments as well in many countries, just to allow for the first lockdown. Let's put that way. But what you see is that many countries have been extending, reducing the number of beneficiaries, requiring other criteria to be eligible. But especially in Latin America, we have seen countries expanding some of the cash transfer programs. And also in terms of how the society have reacted to it, I think that the pandemic made very clear the missing middle in terms of social protection that were not covered. And there is pressure from the civil society in order to increase and enhance the social protection system as a whole. But for the future, we need to keep an eye on it. But we can see that at least in some countries, for example, Morocco, have announced the reform of the social protection systems with a view to turn it more universal. So over to you, Maya, for the other questions.
Sure. So I'm going to address Sorry, can you hear me? I'm going to address the question of specific interventions for fragile and conflict-affected countries. So in the report, we actually mention a few of those, and the important conclusion of that is the importance of humanitarian actors aligning or piggybacking on existing social protection systems within these countries wherever they exist to strengthen the response. And some quick examples I can provide here is that in Palestine, the Ministry of Social Development had shared the waiting list database with Mercy Corps so that Mercy Corps can finance the response for the people within the waiting list that the ministry can't afford helping in the start of the pandemic. Another great example is in Yemen, where the introduction of an emergency cash transfer program by UNICEF was based on the beneficiary database and also all of the system infrastructure and processes of the country's existing social solidarity fund. So here, they also, an element of that was working through existing national systems. And another example from Syria, is the introduction of an emergency cash transfer program that was partly linked to strengthening the disability registry within the Ministry of Social Development's apparatus, and also utilizing the waiting list of the registry of the ministry in particular. So I think for fragile and conflict-affected countries, something that we highlight in the report is definitely collaboration between different humanitarian actors involved, which is really key, but also not creating parallel systems, but aligning and piggybacking on existing ones wherever that is possible. Thank you.
Thank you, Maya. There's time to take one more round of questions. So there is a question in the chat about if you have assessed how administering social assistance was simplified, example, the application process. So yeah, I think you have addressed that, but it'll be great to go over that. There's another question asking if there are any suggestions on how to reach informal workers. And then there's another question which goes back to the social registries, and it says there are arguments that social registries for identifying the poor pose a risk to be more exclusive rather than inclusive. What are your thoughts on this? So back to Fabio and Maya, and then we will hand over to Mansoor for wrap up.
Maya, can you reply to the simplification?
Yeah, sure. So in terms of the simplification, some of the things we've seen is that countries had eased their eligibility criteria, number one, and within the ease of eligibility criteria, a lot of them had reduced the number of documents required to verify a person's eligibility for a program. And this was seen across a lot of the countries in most regions. So this was one of the ways in which application processes were eased. Another way was that for some countries that relied a lot on in-person meetings to verify eligibility, some countries had opted for digital or meetings via Skype, but other countries had removed or waived this requirement entirely. So we've seen that basically countries opted to include as many people as possible, as opposed to pick and choose things or people as they did in normal times. Fabio, if you want to answer the question on the social registry, I can also talk about the suggestions for how to reach informal workers. Just quickly, as was mentioned in the presentation, local actors, here we mean NGOs, local governments, workers' unions were really important to ensure their inclusion. So in the report, we mention how collections of informal workers were really important in the Philippines to actually identify informal workers to benefit from a particular governmental emergency cash transfer program. In India, we've seen that local governments and districts were really important in identifying informal workers that were migrating from one region to the next due to lockdown. And without these local governments, the identification of that large number of informal workers wouldn't have been possible. And we've also seen in the example we mentioned before in Kenya that local actors from informal settlements were really important in identifying informal workers and youth that were within these different informal settlements that were targeted by the program. But in addition to informal workers and how to reach them, there's also digital and open registration mechanisms, which were really important. So for those informal workers which could not be reached through community-based targeting, then open registration was a good alternative to ensure that they're included. And just to mention an example related to the exclusion of social registries, we've seen some countries work on improving the inclusivity of social registries. For example, in the report, we mentioned how Djibouti had actually worked in collaboration with international organizations to expand the social registry to non-nationals and refugees to ensure that the identification process for the emergency program, which is going to go through the social registry, targets not only nationals, but also non-nationals. So the pandemic was also an opportunity to expand the inclusivity of social registries, for example. But over to you, Fabio, for further elaboration.
No, very few points to add. I think that in terms of the informal sector workers, there are two different experiences. So many countries now have what is called a monotax. That's basically just a facilitating regime with special rates to include informal workers in social security. So this database were actually used, but mostly in Latin America is where we have more of these examples. In Sub-Saharan Africa, as you saw in the presentation, there was also a large number of wage subsidies paid to informal workers, but that was not based in monotax, this type of regime. It was mostly in registries that the informal workers have for special occupations. So for specific occupations where you have informal workers organizations, you were able, for example, those working in markets, you were in street markets, you were able, because they have to have the license of the city, of the mayor, so they were able to be identified and be paid. So there are different examples, but in terms of largest coverage, the largest experience that we have is mostly in Latin America with the use of the registry of the monotax. In terms of the social registries, as Maya said, I mean, social registry doesn't mean that we have the whole population covered, but the intention is that now, with the experience of the COVID-19 response, you can use different instruments to amplify the coverage of social registries and avoid that you need to have this open registration process with very few verifications in order to pay first and then verify later. That was the experience that we saw, and not only in developing countries, not only in the global south, we also saw it in the developed world, in the advanced economies. So many people think that we're not prepared, but the advanced economies need to put new measures and had to innovate in order to cope with the COVID-19 pandemic. So over to you, Shivani, thank you.
Thank you so much. Over to Mansoor.
Thank you so much, colleagues, Maya, Fabio, Shivani, dear participants. I think this was a very insightful conversation, and what it tells us is that one of the key challenges we have right now is how do we build on this momentum? How do we make sure that we build on the political will that government has demonstrated in investing in this area? It's very clear that now it's understood that social protection is an investment. It's not a handout, because it has so many multiply effects that can really help build this recovery, job-rich recovery that we try to achieve. So I would say I'm hopeful that all these good practices can help us all think about the best ways to support our governments, country offices, to make sure that their policies are better geared towards achieving that goal. So we look forward to continue working with you. This is just the start of a conversation. We hope that this set of good practices can be helpful for you. We look forward to hearing from you. I mean, feel free to reach out to us, to Shivani, to Maya, to Fabio, to myself, Samantha, and Ricardo, through the Committee of Practice to tell us what you think, how we can help, and we'll be happy to provide this support. So thanks again for a very lively and useful conversation, and look forward to continue working closely with all of you. Thanks again.